the Children and Young People's Committee for October. My name is Christine Townsend. I'm the chair of today's committee. Just to do some housekeeping, we're not expecting a fire alarm, so if it does go off, we will need to evacuate, and we go out through the main entrance and then collect on the top by the cathedral. So I think if I go to my left and we introduce our committee members, but we'll start with yourself, Ian.
Ian Hurd from the Policy Committee team.
Councillor Katja Hanshin, Brislington East.
Councillor Ellie Freeman, Bedminster.
Councillor Shona Gemfrey, Lawrence Hill.
Councillor John Glandris, Stoke Bishop.
Andrew Varney, Councillor for Brislington West.
Councillor Kerry Bales, Hartcliffe and Withywood.
Yasin?
Yeah, Councillor Yasin Mahmood, Lawrence Hill Ward.
Thank you. And welcome to our officers. If you introduce yourself before you speak. But I noticed that we've got a number of new faces, so welcome to our committee, and I'm sure that my fellow colleagues will treat you with the care and attention that you need in your first time with our committee. Thank you. Have we got any? I've not had any apologies or notices of substitution. Okay, so we're expecting Councillor Carr. Okay, thank you. Have any committee members got any declarations of interests noting on the agenda? Katja?
Yes, I do. I'm a governor of Brimhill Infants, which is the school that runs the unit at St Anne's, which we're talking about in the papers. I think it's the 3rd.
Okay, thank you. And Councillor Varney?
I know we said it probably isn't necessary, but just to cover all bases, just to let members be aware that I am the local councillor for Brislington West, in which St Anne's Infant School is located.
Okay, thank you. Anybody else? No, thank you very much. Okay, and so then we move on to item 4, which are the minutes of the previous meeting. Has anybody got any clarifications or corrections on the minutes as they are written? Seeing shaking heads. Can I have a seconder to pass the minutes, please? Thank you, Katja. And then we move on to agenda item number 5, which is the Chair's announcement. So I've got a couple of announcements. The first one is to give you an update on what's going on with the virtual school. So I think I told you last time that we're re-establishing the virtual school governing body. So we've met for the first time, and Councillor Glandris is on the virtual school. Are you on the virtual school? No, I think it's the other Andrew, I think. Andrew Brown, yeah. So thank you to those that were able to attend for that first virtual school. And we will, once we get up and running, we will bring the report, we'll bring some of those reports back, and it'll probably be a summary, really, of what's gone on during what we're trying to do as a governing body for that virtual school. One of the main reasons for that is the extended duties that we know are going to be made statutory, basically, in the Children's Wellbeing Bill, which means in Bristol, the virtual school pretty much on an annual basis will be looking at anything between 8,000 and 9,000 individual children and families. So it's a huge cohort. It's bigger than any school that should ever exist anywhere ever. You should never have anything that big. So it's a huge number of children and an equally huge number of schools that the virtual school staff will then be engaging with. So, and I'm sure that at some point once that bill's gone through, we can maybe have a paper come here so that we can look at those extended duties and see what the responsibilities are from our perspective. Thanks. And the second announcement is around what we discussed quite a lot of detail last time, was about the SEND investigation. So you should have all received your copy of the draft TORs, and that is for your to take back to your parties and to convene with whoever you wish. And I am going to suggest that as a committee, we come together maybe in a week or a week and a half or something after we've had the opportunity to digest those, so that as a stakeholder group we can feed in. Hannah, did you want to say anything further about the investigation from your end and the progression?
No, just to say, obviously welcome comments on the terms of reference that we've circulated. I've also shared that with the Parent Carer Forum. And we are in the process of talking to a barrister who we intend to instruct, and are hoping that we'll have a call for evidence shortly after half term, and in a way that everyone who wishes to is able to feed in a sort of fully confidential manner. So we'll hopefully be able to share a bit more news after half term. Thanks.
Councillor Bales.
Well, I think you probably know what I'm going to say about the terms of reference. I think it's very vague. It's very neat.
Yeah, so we'll have this, when you've had an opportunity to have a look, we can come together and then you can feed that in. Okay.
Cover up, and this is not going to put this to bed.
Okay,
I think that's just going to add fuel to the fire.
Then that you feel needs to be added is what we'll have a committee meeting about.
I've already put forward what I think the investigation should look like.
Okay, so it's for you to lobby then, isn't it, to try to get that you feel is not already in there to be confirmed and agreed.
My perception of that is that what is going to be presented is what we've already seen, which is the fact-finding mission, that the council isn't going to resolve this. That's their view on what happened. But we know that it's much bigger than that. So I don't think these terms of reference are going to make any difference whatsoever.
And that's why they're in draft. Okay, so we've had two statements from Public Forum, but I can't see either of the authors here. One was from Jen Smith around independent specialist sector, and the second one, Carol Casey, about the Whitchurch athletics track and the family cycling centre. And there was a bit discussion as to whether this was the correct committee for number 2 to come to. Given we've just passed the play and youth motion, I felt that it was for us to kind of have this as a piece of public forum. However, as we were saying when we passed the motion, pretty much everything within it is for one or other or more committees to be looking at. Katja, did you want to comment on that?
Yeah, I do agree, because they have got hold of me, although I didn't know they were going to put something in public forum. They have got hold of me to talk to me about it. I haven't progressed it further than that yet. Yeah.
I mean, you're still chairing the one that we're finishing off. So I think, but I didn't want to say send it to another committee particularly when it's come to ours. And I just think it's a really good illustration of how far and how many committees need to be involved if we're actually going to get underneath and improve our play and youth facilities across the city. Thanks. Okay, so that takes us on to agenda item number 7, which is our regular update report that our Executive Director brings to us. So, Hannah, I'll hand over to you to introduce the report.
Thank you very much. So, we didn't bring a Children and Young People's Report update last committee because we hadn't had a performance report during the summer. So this report incorporates the August data and is the latest data that we've looked at through our performance report. And as normal, I'll just summarise some of the sort of headlines in it. As normal, if there's anything you'd like to hear more about or less about, let us know. We're constantly wanting to evolve this and to bring it in line with the reporting functions of the council. So I think the first thing I wanted to start off with as we started term in September was the publication of the Child Safeguarding Practice Review into the deaths of 3 boys, Max, Mason and Darian, at the beginning of 2024. We published a very long piece of thematic learning into the causes of serious youth violence in Bristol at that time. And I recommend that it's read. It is quite a long, complicated document. It is on our Keeping Bristol Safe website, and it does talk about the governance of our serious youth violence work at the time, as well as making a number of recommendations about how we can improve our work, particularly around harm outside the home, extrafamilial harm, and exploitation. So we published that report, we published an action plan alongside it, and there was obviously a number of moments in terms of press. The families were engaged in all of that publication, and some of those families took part in the press that followed that publication. We really recognise all of the continued trauma and concern that surrounds the issue around serious youth violence in Bristol. We have published our Harm Outside the Home strategy, and we continue to monitor that at the Preventing Serious Violence Board. We also saw separately, about 2 weeks later, there was announced by the police that there would be a charging decision made against the deaths of against the mother of the deaths of 3 children in Seamills, which was also the subject of some learning which we have been undertaking with our partners. Obviously, we need to make sure that we don't prejudice that proceedings, so we won't be publishing learning at this stage from that position, but again recognise very significant traumatic events that refers to. We have seen, just moving on to sort of wider national policy, we're still waiting for a number of policy announcements which will affect us. I think probably the most significant is what's now being referred to as a school systems white paper, which is also known as the SEND white paper or the SEND green paper. And we are variously expecting that before Christmas or in November. We're not clear when yet, but we do expect that to have really significant implications for the school system, for the way that SEND funding works, and potentially SEND provision. And it's well trailed nationally that may well have significant implications. It also may well require legislation. So we're waiting for that at the moment, and obviously continue, as this report sets out, to support children with special educational needs in the best way that we can, until and unless any of that policy announcement takes effect. We're also waiting for the child poverty strategy as well as a youth strategy, and expecting a number of sort of further announcements, particularly around early help and preventative work from the government and the opportunity mission from the government. We made a number of changes in our team. So we have got a new directorate or division. So alongside the social care division and the education division, we now have a division which is responsible for commissioning, improvement, partnerships, headed by Heather, who is here presenting our work around transformation and improvement in social care, which is very welcome. Additional capacity to be able to lead in a city like this. We would normally expect us to see that level of capacity. And we also start the year with a fully recruited senior team, which is really good for us. We do expect a number of inspections this year, as we've said. We keep saying probably a focus visit from Ofsted at any time, and a full local authority children's services inspection, a SEND inspection possibly, as well as a youth justice inspection. And we're ready for all of those inspections, and we're well prepared, and we look forward to showing them what we're doing in the city. Just in terms of our performance board met in July and in September and looked at some of our work around family help, which colleagues will talk around in a minute, a focus on youth homelessness and school attendance, and I'll come back to school attendance in a minute. And also included within this paper is an update to our improvement plan, which is the plan that we bring to inspectors when we, following previous inspections, areas that we needed to improve, work against that. And so we're bringing an update of that improvement plan. Our previous plan closed, and so we're starting again with a new improvement plan, which is recorded here in the minutes. So just coming on to, the last thing just to say is around our budget position. So you'll see elsewhere in another committee, Strategy and Resources Committee, our budget position has been published, which showed the P5 position, so the fifth month in the financial year, and we don't have a finance paper on the agenda today. So just to summarise the headlines of that is that we are seeing Some overspends emerging in our budget, but they're not really the usual overspends that we would normally see. We have seen some progress against the placements budget, which is normally where we see overspends, largely as a result of the work that we're about to talk about today. But we have seen pressures emerging in other areas, particularly around youth homelessness, particularly around some of the work that we're doing to support care leavers in housing, as well as some of the work that we're doing around children's homes more broadly. So we are seeing, and that report in front of the Strategy and Resources Committee sets out the overspends that we are seeing in children's and education. We are working hard to bring those down, and we do expect to end the year with a significantly lower position than we've currently got. And there's some positive areas of progress in that as well. So I'm happy to take any questions on budget. Just going back to the paper. So just going through in terms of the data, I won't cover everything. You can see there that we've got the August data on education, health and care plans issued within 20 weeks. As we've said many times, we need to do significant improvement work. We've published an improvement plan in this area, and our performance in August was 32%. However, you'll note that that's a significant jump from previous, reflect August rather than ongoing improvement. We would expect it probably to come back down, but to creep up, which, as you can see over the last few months, it has been creeping up because of the hard work that the team have been putting in to be able to progress those EHCPs as quickly as we can. Just to point out other points in terms of the performance here, we've seen a little bit of an increase in terms of numbers neat over the last 2 months. This is partly because we are identifying where those young people are, so that our numbers not known are much lower. But however, we do need to continue, and it's been the subject of this committee's work for some time, we do need to continue to focus around making sure that young people have got a place in education, employment, training post 16. And the team continue to do so, particularly in South Bristol through the Youth Guarantee work that we've talked about publicly before. We're seeing children missing education continuing to decline. That's partly because we're really focusing, and as you've asked us to do, on why is it that children are not registered in education. In most cases, that is because they have either moved out of the area or they have arrived in the area and not yet applied for a school place. So we're working hard to support those children. In terms of the social, just to come on to attendance. So you can see at the end of the school year last year, we did see an improvement on the previous year in terms of overall school attendance, certainly primary level, but we do continue to sit below the national average at secondary and special school attendance levels. And in the main, as we've said before, though there is a really significant group of young people who are not attending, really significantly, severely absent, we call this group, and we are working to wrap services and support around that very vulnerable group of children. There is a bigger group of young people who are not attending on a regular basis, above sort of 80%, but not as much as sort of 95%. So what you can see is every couple of weeks, young people missing school on a Friday or on a Monday. We do need to look at that broad, what we call persistent absence, that broader group of young people, making sure that they do attend school every day and that matters, because we know that there's a big correlation between overall attendance and achievement in schools, particularly for vulnerable groups. So we will again continue to support schools to be driving up attendance for all young people, and it's got to be a focus for this year. The social care data does show a positive picture, both in terms of the numbers of children on child protection plans and the number of children entering care, as well as things like repeat referrals into social care continue to look positive. We've also published some data around workforce in the social care team, so we're seeing lower caseloads across our workforce team and significantly reduced vacancies, use of agency staff. So we're in a good place, I think, broadly. I know it's difficult, and I'm looking at the social workers here. I know it is difficult, but we are, I think, in a good place in terms of workforce across the city, and we're fortunate to have some brilliant practitioners working with us. And then the other, I know I'm going on, but the other thing this paper does set out is the education data. So it's set because it's the annually. We obviously get this with this data annually. So you can see in the early years foundation stage, generally an upward trend, although we've sort of gone off slightly against the national average from where we were last year, showed a really significant improvement. But you've got a bit of a gap with children living in disadvantage. Key stage 2, slightly positive, sitting just, marginally a bit above the national average. Again, the data starts to show that bigger gap in terms of disadvantage. We are really pleased to be able to find out today that key stage 4 data, secondary data, has put Bristol above the national average for the first time ever, or at least, I don't know if ever, but in a long time, 15 years.
Very long time.
On attainment. So, which is brilliant. And if we've got this really lovely chart, which isn't in the papers, which shows a national average and Bristol bucking the national trend. It's 1 year. It's not enough for any of us, I'm sure, in terms of those leading the schools. And we want to see a 3-year trend, and we want to see that data replicated, particularly for children living in poverty. So there's lots more we want to do, but we should, I suppose, just want to recognise the hard work of children, first of all, and the people who run those schools, the teams in those schools and trusts who've been working hard to support those children. And then sort of the end of the report talks a little bit more about the Families First work, which we're going to come to now, homeless and housing report, which we looked at, which we've made some really good progress in terms of focusing on 16, 17-year-olds in homeless, and our quality assurance process. I'm just checking there's nothing I'm missing. Children's homes, I mean, we were pleased to announce recently that all our children's homes have been rated as good by Ofsted, and which is brilliant. And again, that's something that hasn't happened for many, many years. And again, speaks to the huge amount of work done by the registered managers and their teams working in children's homes. And also that we are opening significantly more children's homes in Bristol, and I think 18 additional beds over the next, team will tell me, over the next year, which it's quite complicated. Some of it has been a bit delayed. We need to make sure we recruit registered managers. We need to make sure that we get them properly registered with Ofsted. Obviously, it's a complicated piece of work, but we have got significantly more beds coming. So I think that's probably it for me. Happy to take any questions. Thank you.
Okay, thank you very much. Right, okay, hands going up. Councillor Varney, Councillor Galandris, Councillor Bales, and Councillor Jeffries. Okay, and then anybody else put your hand up.
Thank you, Chair. Thank you, Hannah. Just a very quick point of clarification. I'm a little bit confused by one of the columns in Table 1. It's the second column, changed since last month, /term. Which one is it? Because obviously that makes a big difference.
I mean, it does depend on the measure. So it's in most cases it'll be a monthly change, but in some cases we don't publish a monthly. We don't have monthly data, so it'll be since the last time we measured it. Sorry if that's
yeah, it would be useful if we knew what time period it's referring to with each row, actually.
Can I suggest we colour code it?
That would help too.
Yeah, should we do that? Should we ask for that column to be one colour if it's a month, and then another colour if it's, what was the other one? If it's a term. How about, can we do that?
Yeah, just
okay.
some sort of clarification,
Yeah.
just so the figures are a bit more meaningful, I think, would be really useful.
Yeah, I'm trying to look
Thank you
through
very
and see
much.
which.
I think they are mainly monthly. But let's clarify if they're not. We'll make that really clear.
And I suppose some holidays might have an impact on whether it's monthly or termly as well.
Yeah, because it doesn't really count.
No.
It's kind of, yeah. Anything else? No? Okay. Councillor Galandris?
Thank you, Chair, and thank you, Hannah, for your report, and thank you for your news on attainment. I mean, that really is a fantastic piece of news. I mean, it really is. I mean, for somebody who's followed the education scene for many years, I'm not an expert on it, but normally Bristol's been lagging behind, whereas if we're ahead, that's fantastic. And as you say, 1 year, one swallow doesn't make a summer, but it's a pretty good sign, and hopefully we'll see more swallows following next summer. Just one little thing I just wanted to probe, comment. It's not really a question. You did cover it, and that's the percentage of 16 to 70-year-olds not in education, employment or training, the NEETs as we call them. It is my hobby horse, because, and I know we're probably better than other authorities at collecting the data, so we might be slightly our data may look worse because we're better at collecting it, but nevertheless, this is an area that really worries me, because if somebody is not in education, training or whatever, I mean, they're not doing very much, and the risk is that they stay doing nothing for a very long time, if not permanently. So I think that's where we need to put a lot of emphasis. I know you are putting emphasis, but that is so important. And the figures, and maybe because we're just better at collecting them, but they're not getting better, and they are much higher than the national average. Thanks.
Yes, and I mean, I think it is also seasonal, but then so would the national average be. And I think so. There's significant work going on, including with the colleges, around whether we need to vary, for example, course start dates, because often, if the course starts in September and there's a reason, so whether we can do more January dates or whether we can do more flexible work. There's the college are doing quite a lot of work in the south of Bristol to be able to offer additional provision as well. So yes, I think the team, I don't know if Vic wants to add anything, I think the team are doing everything they can with our providers to make sure that we do have a place in education and employment training for and we track them, as you say. One of the reasons why it's higher, although it is a technical reason, is that we know where they all are. The next step is to make sure they're in provision, for sure. Is there anything else you want to?
No, I think I believe we brought a report in August which set out in quite a lot of detail the different programmes and how, so I won't repeat what's already set out in there, but what we are starting to look at is our comparison rather than the national average, because there are a large number of local authorities that aren't tracking as well as us, but comparing benchmarks against core cities with a similar level of tracking so that we can start to look at the dynamics for us as a city and how that's different and how we can intervene in that space. We are also continuing dialogue with West of England Combined Authority around funding, and more funding in this area, which we know that they are committed to. So again, there's a regional direction of travel there, and also links with the national position.
And Councillor Bales?
So I've got two questions, one on electively home education and one on contacts to first response. So I always ask this question, how many electively home educated kids are actually electively home educated? Because in my ward we've got the highest number, and I don't think they are electively. I think they're pushed into it, and then we've got the figures on NEET and stuff, so it's kind of like, where do those children fit in? Are they getting educated at home? Because I know what that's like to have a tutor in your house or have to go somewhere else, and I can guarantee a lot of those children aren't. So, how are we going to change that? And is it really elective? And my second question, so I always ask on the contacts to first response, how many of them are malicious? But I want to go a bit further than that and ask specifically on FII, which is fabricated or induced illness, and how many of those cases are actually proven?
Yeah, I'm going to have to come back to you on the second one. Sorry, I don't know. And let me find out more. And I mean, on the first, so there is a sort of so EHE will only relate to pre-16 children. NEET will only relate to post-16 children. But I mean, as you know, there's a process for confirming the formal status of electively home educated children as being decided by their parents to be electively home educated, and in many cases that is a positive choice and is done well. Obviously, the concern is about whether parents have been encouraged to electively home educate their child, and I think that's what you're referring to. And obviously, if there is any sense of that, then, and also we do look back at the previous school that the child attended before they chose to electively home educate the child and look for any patterns there. And that is a piece of work that the service are doing to make sure that, you know, if there are significant schools that are seeing quite a lot of EHE children coming out of them, what's happening there. But yeah, there is a legal process around it, which is what this is counting.
Sorry, because in my ward we've got the highest number of EHCPs and probably the highest numbers of electively home educated kids. So that's like really concerning. You know, they need to be educated. You know, we want to change their future. If we don't have aspirations for them, why would they have aspirations for themselves? So we really need to change that.
Yeah, and I mean, as this data says, 44 of the 703 electively home educated children have got an EHCP, but we'd be really happy to do some work on the numbers in the ward and where have they come from. And as I say, sometimes parents choose and that's fine. It's also, you know, and I know the Children Wellbeing Bill is looking at this as well, and looking at the quality of electively home education, so we should just keep an eye. But really happy, Councillor Bales, to pick up with the number in the ward and having a look at where they've come from, if that would be helpful.
Kerry, can I suggest that that you bring this up for the Task and Finish group, and that we try to have something within that is a recommendation around EHE, because we have looked at it, haven't we, as a group of children, and maybe we might have some targeted specific recommendations that we might ask officers to try out or come forward with, something like that. Yeah, okay. And Councillor Jeffries.
Hi, yes, thank you for the report, and I was particularly impressed about the assessment timeliness improving so much. I know that's hard work, so thank you. I had a couple of questions.
Councillor Jeffries, it's only for August. It's 5% to date.
I'm talking about the assessment timeliness from the social work teams. It's up.
Oh, all right, beg your pardon. Sorry, I thought you were talking about EHCP. Sorry,
No,
I thought you'd seen the 35% and went, oh, look at this. There's
No.
5% to date. Sorry, beg your pardon.
No, apologies. I should have given some context there. So I'm looking at page 27, and I had a bit of. There were a few paragraphs that I wasn't quite clear on. I wondered if you could clarify. So paragraph 20, when it says there is a reduction. No, sorry, it's not that one. Where did it go? There was a... My apologies, I was looking at something else. Where did it go? Sorry, paragraph 19. So there was a decrease in demand to the front door in August, which I presume that's because it's the school holidays. Then it says, so we've had a 5% increase on referrals this financial year from last year. But there's been a larger increase, 53%, in the number of referrals subsequently made, and I didn't really understand that sentence. Could you just clarify it?
So when the referral comes to first response, there's a number of places that it might go. What we're seeing is far fewer referrals having no further action. Yeah, so, and therefore, some of them might go to early intervention services. Others might go to homelessness, young people services. Others might go into social care, into the statutory area. That 53% increase really stood out to me as well, because what that is indicating to us is possibly one of two things. Firstly, that the assessments are clearly much more thorough and much more consistent across the service, but also that possibly needs are rising, and therefore there are more children with higher levels of needs that are coming through the first response door, coming into first response. In some ways it's good, but in other ways it's like if there's more need out there. But however, clearly when they're coming into the service, we've got a better handle as a service on what the needs are and how those thresholds are or aren't met for those various children.
Okay, thank you. Yes, so the referrals to the front door have increased slightly, but of those, a much larger proportion are then being moved on to children's social care for the reasons and that could be to do with the cost of living crisis and all sorts of things that's affecting people.
Councillor, I also feel this is the year group. These are the year groups that were in transition during COVID, and I think, and that also it feeds into our needs as well. These year groups are those that were already vulnerable and disadvantaged. We know, had the worst times during COVID, and therefore will take arguably a bit longer to recover from that, and so. Over the next couple of years, we'll see those years move through. The impacts of COVID are not over yet for children or their families, really.
Cool, thank you. And then my last question was on paragraph 23, the sentence, the number of children in care did increase in August due to reduction. Sorry, I just misread it. That's fine. Ignore me. I understand now. Done.
And catch a hook.
I was just going to clarify with the EHCPs. It sounds 32% sounds like a really good positive number, but I do realise that that's the August number. So we're assuming that it's going to go back down to a lower number in post-August, September, October. Is that correct?
Yeah, I think we're looking at two parts, I suppose, or three parts, in fact, when we're thinking about the performance of the SEND service in that space. Timeliness is one part. The second is the overall output of the service in terms of bringing down the backlog. And the third is about the performance of the education psychology service and being able to complete those assessments. So, in sum, we need to triangulate the three of those together in terms of the different contact points we'll have with families and how we bring the backlog down, because timeliness won't necessarily give us a sense of whether the backlog is coming down, and that's the aim of the improvement plan that we published and shared with committee at the last meeting.
So we're still following the plan where you said that you were going to try what you were doing was you'd had a whole group of children that came up with that lost their top-up fee. We're going through the EHCP process, and I understand that they still have support in place. So that's the one thing I wanted to know, but that should be dropping off now. Because you do have less numbers than last year.
So I think, if I understood correctly, you're referring to the number of new requests for children who were in receipt of top-up. So those will continue. We will continue to fund those until the assessment is complete.
Yes, we know that.
We've also made a commitment to our schools that where there's a delay in the assessment, we will backdate all funding, assuming the Education, Health and Care Plan is approved and completed, to the point at which that 20 weeks would have been up as well. So again, to make sure that schools are not penalised for some of that delay. So this is set out in the EHCP improvement plan, which we published in I think it was September. But those are two of the aspects I think that you're referring to that we have made in terms of policy change.
Because it's quite bad if you have over 1,000 new applications, but you've only managed to actually get 686 issued. I'm assuming that not many of the EHCNA plans are being declined. Is that do you know how many percentage of them are declined or not given?
I do have that. If helpful, I can provide that to you after the committee. It's on a file.
Yeah, because it just shows the plans of how many there are. I mean, 41 weeks or 42 weeks, what it is still a really long time. That's almost a school year, and in a child's life, that's a long time.
So I think the what we have seen is a reduction in the overall time. I'm just trying to find it in the report, but it's approximately 49 weeks down to 42, which is quite a significant reduction in the length of the total time in the backlog. It has been as much as 52 at one point, 52 weeks. Right. So it's an improving trend, but it's a momentum we need to sustain for a significant period of time, probably for the remainder of this academic year. to get to a point where that backlog has come down to a more manageable level.
Is that still because we're stuck in the place for educational psychologists and NHS help? The length of time?
No, I think the health service has been quite timely in their responses, where we've requested support from them or advice on whether they are working with a child already through that work. Education psychology, we've seen roughly a 44% increase in their output based on last year's output. So it's been a very significant improvement in their performance, and their backlog is coming down now at a positive rate. This is, I suppose, as we've said before, mostly linked to the withdrawal of top-up and schools seeking funding from alternative sources.
So I'm still quite disappointed by the numbers with the EHCP plans, I have to say, because I know how long parents wait for them, and I know how traumatic it can be waiting for the help that you need, and then having to go through all of the processes. There was one other question I wanted to ask about the CAM.
Is it possible just, so I suppose I just wanted to recognise that, and I obviously I'm responsible for this service with Vic, and I mean, as we say every time we meet, that we do recognise how long it's taking to be able to
it's a huge chunk of a child's life.
These EHCPs. It is a Bristol issue in the sense that the top-up was removed, and as we know, a large proportion of that group are continuing to be supported, but obviously moved from being supported in school to the front door of the service. It is also a national issue where, the national average is 50%, 40 is less than 50% at the moment. We're way below that, and we want to get at least to that. That's our ambition. Vic has recruited really significantly into the service. As you know, that does take time. And so we've got a lot of staff coming into the service. We've also had a lot of EPs coming into the service. So we're moving slowly. And as we've said before, the service is moving as quickly as they possibly can. We have seen the numbers for the first time come down of new requests for assessment.
I saw that, yeah.
What we may be seeing a little bit of is, as there's some concern about where the SEND white papers coming, we may see more demand from parents wanting to have children assessed earlier. We haven't seen that as much here, so we are seeing demand coming down, which is a good thing probably. But I suppose I just wanted to recognise the frustration that many will feel around this, and also recognise the efforts of the service in trying to meet that.
One of the questions I'm wondering is does that have a knock-on effect of children that are electively home educated that we think are not quite electively home educated, encouragedly home educated, shall we call it? Would that have that would have an effect on the EHCPs not being in place? And then I also wanted to talk the 225 children waiting specialist provision. Do we know where they are? Are they in the school that's not right for them? Are they at home?
Yeah, I don't have the specific data in front of me, but there is a mix. So there are a number of children who are in a mainstream school being supported with additional funding in place. There are a small number that are missing education, and where we are actively looking for a specialist placement.
Some of them would be in the missing education figures. So I'm wondering, with this whole EHCP backlog and with some of these other things waiting for specialist provision, I'm quite sure that's affecting our children missing education or electively home education children as well. It's affecting those figures as well.
Yeah, I think to also comment, the children with an EHCP that are home educated figure has remained steady for the last, certainly since the beginning of this.
I'm talking about the ones that are waiting for
calendar year.
EHCP.
And then that's a different cohort, yes.
Thank you. That's later.
Anybody? Any other committee members wishing? Councillor Varney and then Councillor Mohammed.
Sorry, just going back to table 1 again in the paper. The column direction of travel, what is that pegged to? Is it direction of travel from the previous month or term or last year? So I'm not quite clear. And obviously, having clarity on that would be quite useful as well.
Yeah, so I mean, sometimes, so it will be looking at the direction of travel since the last point that we're measuring it. So it'll be the month, where the month is the measure, which is most of it is. And obviously, as you can see here, sometimes it's not appropriate for us to make a judgment, particularly children in care, children in the HCP plans, whether they go up or down is not a sort of good or a bad thing necessarily. But where you've got the green and the reds, if you've got a green arrow going up, that's a good thing. Do you know what I mean? So it's trying to indicate that. But if it's a black arrow going down, that's because we're not being... So the number of contacts to first respond... And by the way, I think, Councillor Jeffrey, I think your question was about the difference between contacts and referrals, which we'll make more clear I can make clear in the next iteration. But, you know, whether we have, you know, 1,600 contacts or 3,000 contacts, we're not making a judgment on whether that's a good or a bad thing. It's just a noticeable sort of activity data.
Yeah, I think it would be useful just to clarify that column a little bit more than so direction of travel based compared to the previous indicator, just so it's clearer. Thank you very much.
Yasin?
Yeah, thank you, Chair. Again, this table again. My query is the total school suspension rate is increased. So do we know which terms that school suspension and also which schools, secondary school or the primary school? Thank you.
Yes, so we have seen an increase in suspensions in all areas. We've seen a reduction in exclusions, but an increase in suspensions. So these will be fixed term suspensions within schools. And they are in all three. So they are in primary, secondary and special. And what you're seeing there is schools responding particularly to behaviour within the school, but not to extent that the child needs to find another school. So they're suspending them for a number of days. And it is something that we're working really hard with the schools on, because obviously we want to make sure that, well, children in school learning, they're not disrupting other young people's learning, but that they're safe and within the school. So where you see a number of suspensions rising, we will be having conversations with the school about what's happening there. Is there any support, particularly within families, schools, children that we could be offering in any case? But we are also seeing that nationally as a rise in suspensions within schools. I don't know if there's anything else.
Is there any data like the collected like from term 1 to term 6 saying like that term was higher than the other term? So we can see that.
We can bring that data.
Quite a lot of this data comes through the quality and improvement performance. And we also get the names of the schools, although I think that we probably black those out here at this time. That secondary will be higher than primary. And yeah, that we will also see some suspensions in special schools, unfortunately. Okay, Katja?
Sorry, on suspensions, I actually wanted to ask a question because I've had some knowledge of being on the other side of being a school teacher. And one of the things that children often get suspended for, sadly, is racism. And that's an almost automatic suspension in most cases that I've come across. And I was wondering if there's a relationship between what's going on in the country and on Twitter, not Twitter, they don't watch Twitter, they watch TikTok, and racism, because I have noticed that whether there is a correlation with that and if there's something we could do about that. It's a big question now, I don't expect an answer.
Yeah. I think that it's probably a bit early to look at the data because it's a relatively short period of time. However, there is some community sort of cohesion work that is being led largely by public health. And I've said we also need to be involved in that, and we need to bring in our schools so that we can find out if they are seeing an impact of the local and the national context within what's going on in their schools, and then how they're then responding to that. So it is something that's kind of it's on the radar, should we say?
I didn't expect an answer now. I was just highlighting it as a point because I have noticed it in the last school year that's been increasing, and also sexism as well.
Okay, anybody No? Okay, so shall we move on to then, thank you very much, Hannah, agenda item number 8, which is the transformation programme for children and education, and this is the update. Hannah, I've got you down as being introducing it, but I'm assuming that there might be some other comments from some of our other colleagues, yeah?
Yeah, actually, Heather's going to introduce
Okay,
us.
sorry.
With our team here. So.
Heather, introduce yourself first. Welcome.
Thank you. Heather Story, Director of Strategic Improvement and Collaboration, the new director that Hannah referred to at the beginning. Just to give a quick introduction, and this paper updates on a number of transformation programmes, namely Families First, Children's Homes and Home to School Transport. I'll actually take them not in the order in the paper, if that's all right, because as you'll have noted, we've got some colleagues here to speak specifically on the Families First programme. So I'll just touch on Home to School Transport and Children's Homes first before we get into that. We're continuing to work in Home to School Transport to improve our services, particularly grateful to students, parents and carers for their patience while we've been making improvements and efficiencies in this area. Phase 1 of the programme has now closed. It has completed and done its evaluation. The Parent Carer Forum were particularly helpful in supporting our post-16 policy development, and all applications were processed that were received on time, and they're all now receiving support. We have 5 new electric vehicles in place. There will be 23 in total, and permanent drivers have been recruited to work those services as well. Travel training was also developed over the summer, and we have 20 children per term going forwards into independent travel training. Phase 2 will be opening from August, with routing and cost improvements and improving quality for children and young people who are travelling those routes as well, we hope. Some work on communication demand management, hopefully to reduce demand into home to school transport services, as well as some technology and systems, including some kind of efficiencies around application process as well. Is it helpful to pause for questions after each one? Any questions on on home to school transport specifically before I move on to children's homes?
Councillor Bells?
Because it's one of my favourite subjects. Not. So I think I asked this at the last CYP committee. Obviously, the closest school to the child isn't always the most suitable, so I'm assuming that reasonable adjustments would still be made, because if the only school that can meet that child's needs is out of county or across the other side of the city, and that's the only child going there, then obviously they can't get in a taxi with lots of other children, or that might be a part of their condition. They might, that might not be as suitable. So I just want to check that reasonable adjustments will always be made.
This is a statutory service, and yeah, we have an obligation to ensure that children are able to get to the right school for them safely. We can provide that service in a number of ways, and often, although you're right to point out, there will be instances where the right mode of getting to school will be in a single vehicle for a single child going to that school, but it isn't always the case, and we're keen also to improve and work with children to develop their independence where it's possible. But our statutory obligation has not changed, and our application process continues to assess children based on their individual needs.
Okay, thank you. Should we go on to which next? Children's homes.
Children's homes,
Yeah.
That's okay. So our Children's Homes programme is continuing to deliver an additional 18 beds across 8 homes in total across Bristol. There have been some delays in this programme due to contractor and supplier issues, particularly recruiting, and Hannah mentioned this earlier, qualified registered managers. It's a national issue. Trying to recruit the right people to manage our homes is obviously critical to their success and to the safety of our children and young people. So we are reporting an under-delivery of the 1.1 million savings that were applied to this programme. They will still be delivered, but they're being reprofiled into 26, 27, and we're taking our time to make sure that we've got the right people running the homes for our children and young people. We do now have a strategic partner in place who's really experienced and we're happy with. So they're getting going in those homes, and phase 2 will be coming here in January on kind of further developments on children's homes as well.
Any questions on children's homes, Katja?
I've got 2 questions on children's homes. The one is that the Gorham home had 2 houses that was empty since January, and we were told that they would be occupied by October. Are these homes now occupied or being occupied? They're 2 Gorham homes.
They're not. They will be operational from February. I can probably give you some dates.
Is there a reason why? Could we give a reason why they've been for so long been empty? Because they've been ready since January 25.
Yeah, we're waiting on a certification issue. It's pretty kind of minor
Is this
administrative
one of the
issue.
reasons why the 1.1 million is underspent?
Yes, although not the major issue. So this strategic partner has been recruiting registered managers. That's the critical issue, is recruiting registered managers.
Because there's a lack of registered managers.
Yeah.
Not because we line them up before the house is finished.
No, it's a national recruitment issue, is getting registered managers who are appropriately qualified.
Pay them enough.
Tell your government.
Sorry. Nationally, obviously, not just Bristol. The other one I did is I just wanted to ask a question. For how long are we, for disabled children, for how old are they before they aren't under children and young people's anymore?
Sorry, say that again.
For children with disabilities, how long, and young adults with disabilities, how long are they, what age are they? Because they go over 18 or over 16. So what age is the cut-off point when they're going to adults?
So the cut-off point is 25.
25.
The transition point is dependent on the child's individual needs.
Okay.
So it doesn't always go to 25. Sometimes it's appropriate for them to move into a different provision before then, but 25 is the cut-off.
Because that is something I'd like our committee to look at in the future. I visited Brislington home in School Road, which is run by Bristol City College, and it was for young adults with learning difficulties, and they were all in that 19, 20, 25 rate. And there were quite a few questions I had there, one on investment of the building, and the other one was, they did a lot of travel training, by the way, and that was really successful. It was a very good point they brought up. But it was a very positive and lovely visit. And there was a lot of questions I had to ask, whether we're responsible for that or who else is responsible for some of the upkeep on their building. That was one of the questions. And also transitions, which is something we can't answer now, but it's something I'd like us to look into in future, because they gave me a whole lot of things, pointers and stories that I'd like to reflect on.
More than happy to look at that. I don't know the answer on the building, I'm afraid, but I can check that unless anyone else knows, and come back to you.
Well, let's come back to you.
Yeah, thank you. Thank you very much.
And just it's worth saying that on transitions, I think we're all keen to do quite a lot of work on transitions.
Yeah, because there's quite a few things that happen that we're like, okay.
Yeah. And just on children's homes, as I say, we've worked really hard to get 8 children's homes, 18 new beds, significant numbers of new beds in place. We have had a number of sort of issues around the procurement of a strategic partner, the building of the homes themselves, registration and recruitment. But as Heather said, and we can set out more broadly when all the homes are opening. But we are hoping to have at least 8, 9. I'm looking at some of the team who know this better than I. Open within the next year, which is really good news.
Thank you.
And Councillor Bales?
I just want to pick up on what you said to Katja about underpaying staff, and you said ask our government, but you seem to have forgotten about the last 14 years of the previous government and the mess they've left, not only education but the NHS.
No, I've not forgotten that, but Labour are now the government, so it's for that national government to now rewrite or repair or look at where the gaps are, particularly within children's services, and start investing in our young people. That's the point I'm making. There is, so if we look at Councillor Collar, go ahead.
Yes, right. It's just, I don't know the ins and outs of it, but you saying about children's homes and for children with disabilities up to the age of 25. But obviously then you've got to think about, it just made me think of what do we do with them when they're 25 and how closely does Children and Young People Services with that transition work with adult social care and housing, because obviously if they're not able to remain in the children's home at 25, where are they going if they still need that kind of supported living? And how are we working with housing? Because obviously it's building homes for adults now that need specific support and specific needs. And how well are we managing that link with housing?
I mean, really happy to bring, because I think we're doing a lot of work with the Housing Directorate around that area. Well, both us and adults and housing are doing that. So really happy to bring either a further information update or to include it in this report if it's helpful, because it would be really good to share that and talk about what else we can do.
So there is now a pathway within housing that is specifically for young people that are showing as being homeless from the age of 16, and that is new. That didn't exist under the previous administration. And the work with adult social care, some of those children might have a social care assessment at 18, some of them might be 25. I mean, if they are going up to 25, that's because they have an EHCP. So, and it will depend on what the progression is for that young person. So if there's another course for them to go to where they will be able to make progress, and then they'll keep their plan. Whereas for others, it might be more suitable for them to join into go into the adult social care if that's needed. However, we know that the percentage of children with of adults with sort of learning difficulties in unpaid employment is about 6 or 7%, and it's really known nationally. And that is certainly an area where we need to get better, not only in Bristol, but in the region and at the national level, so that there is better support for those young people as they go into the place of work. But that also then, we need to be looking at them when they start school or when they come to the point where they need an EHCP. So it's kind of getting better support in all the way through. But yeah, I mean, it's happening, I suppose, and we're trying to develop those links across what are basically the three core services within a council, even though everybody wants to talk about parking. And I just wanted to draw it before we move on to the third bit, where it talks about point C. So this is the Coming Home Planning Project. So 30 children moving back into Bristol, into the family-based. So the plan was for 8. They wanted to get 8, and we've got over the summer we've been able to bring 30 children home. Now, not all of those children would have been in out of care children's homes, but some of them would have been. And for some of those children, their care plan would have said that really they need a foster family, and it would have been that they would have come into care at a time when there just wouldn't have been one that would be suitable for those children. So that is a really positive piece of work that's been going on over the summer as a result of the investment that's gone into social care and the additional work that was needed to be done whilst we're doing our day-to-day kind of this is what we do, this is what happens in social care. There's this other piece of really specialist work going on that we're now beginning to see the benefits of. Yeah, oh, okay, and you can talk about it now, sorry.
It's quite all right. I'm only going to speak very briefly because we've got the team from Families First here, but it's our, a huge transformation programme. The business case was approved here back in May. Since then, we've already seen significant results. As you said, 31 children moved back to remain with their family rather than entering care. 22 children to achieve permanence outside of care each year, 42 to step down from out-of-authority children's homes, and 17 more supported through high-quality internal foster families in Bristol. So just a quick update on kind of where the programme's got to so far. Design leads have been seconded into the programme. Here they are. We had a launch event in May. 30 children already moved back to Bristol, as you've heard, or into a family setting from out-of-authority homes. Connecting families work stream has been established. There have been 49 reviews to support children in external homes. Foster care and vacancy register has been established. This is basically allowing us to have a proper view of our foster carer capacity. Programme governance has been established as well, not quite so exciting, but pretty important. And there's been really significant investment in additional social work staff and family help work to prevent crisis, including 2 specialist teams, Safer Connections and Connected Families. The programme is fundamentally focused around outcomes for children and young people, and we think that improving those outcomes will also deliver a significant financial benefit. So I'll let the design leads talk about the work that they've been doing.
Thank you. So I'm the programme lead, so I'm sort of responsible for overseeing the programme as a whole. Probably one of the more important things to say is that this is a whole system change, and we've all been appointed. I'll introduce you to some of the design leads who'll be able to sort of talk to you about the individual projects, to look at how we can sort of deliver some really tangible outcomes for children. Clearly with, you know, a lot of the targets that we've set through the programme evident in the paper, but also the financial savings alongside that. But I think what we really wanted to convey was the different approach that the transformation programme is trying to take by having that combination of people that, you know, are already part of the services of the children and families that we serve. Probably feels like a really obvious thing to say, but we think it's really, really important to do the right things for children and families. And that also that we're representing the services that we come from in the right way, and that we can do that sustainably, and whatever the changes that we seek to introduce are changes that we can actually support the teams to do long term. That we've got quite a lot of knowledge and expertise in all our relevant areas that we can bring to do that, to achieve it. We are only part of a bigger team, so the bigger team also involves our strategic partner, and other design leads that are responsible for some of the other projects. And the way in which that's working well for us is that the mix of skills that we've got really complement one another, which means we can hopefully deliver things a lot more quickly than we would have done had we just been working in our sort of ordinary day-to-day jobs. We've got really clear targets about what we want to deliver, and we think, you know, that's allowing us to make that tangible change, so we can do some really quick early work, such as the coming home, which can really evidence, you know, the difference that we can make, but also, whilst also sort of gathering momentum with some of the other projects. Not all of the projects will start to show the benefit at exactly the same time, so it's really important that we sort of do that as a collective piece right the way across the system. But we also have really good relationships with our teams, and so integral to the vision that we've got is how we can support them through like good engagement work, good communication, change management, being effective, etc. So that's sort of a bit of an overview of the programme, and I'll just hand over to some of the design leads who will give a little bit more detail really around the individual projects. So Adam.
Hi, I'm Adam Asgar. I'm the design lead for the Value in Family stream, which the focus of is around our young people coming into care and trying to reduce that number. So we know that children they have better long-term outcomes when they remain at home. Often that's even when they've suffered harm when they're at home. And also we know that it's the right thing to do to try and support children and families to stay together. So that is the focus of the work that I'm doing. I'm going to give you a very quick kind of overview, but if there's more questions, obviously feel free to ask. So there's 3 different kind of areas that I'm focusing on in terms of the work that I'm doing. One of them is around looking at our existing practice within our social work kind of neighbourhoods and teams. So we know that we have a really committed workforce and they work really hard to try and keep children and families together. That is, I've worked in those offices for the last 10 years. I know that's what we're determined to do. We want to keep all children and families together. But we also know that the job is really hard, and there's lots of bureaucracy and lots of processes you have to follow and lots of challenges that you'll face in trying to do that. So part of what we're trying to do is look at those challenges that our teams face by collecting all of the data about our children that are entering care, and really starting to unpick that and see if there are places where we can change things to make lives better for our social workers so that they can then support children and families to stay together. So it's kind of making sure that our social workers have the right tools to be able to support children and families to stay together. So that's one of the pieces of work that we're doing. The other one is around the Connecting Families team. So that's already been mentioned previously, but that is a specialist team that will come alongside our kind of lead professionals, so primarily our social workers working in the neighbourhood areas. They will come in alongside for children and families where we're concerned that there's a risk that they may enter care. So when we're seeing crisis, when we're seeing things really stressed at home, or when we're really worried about the safety of children and we're thinking that we may need to seek legal advice or kind of escalate through our systems and maybe children then won't be able to remain at home. So that team will come alongside social workers and they'll offer a really intensive intervention to families. We know social workers are really busy. We know they have lots of things on, and often it's not that they don't have the ability to do that kind of work, but they often don't have the time. So it's about giving somebody that time to build those relationships with families, to do those really intensive interventions with them. So we don't have a time limit on the amount of time that they're going to remain involved with children and families alongside social workers, but we need to kind of develop systems to make sure that the intervention that they're providing is really meaningful. So far they've worked with about 45 families, I think it is at the moment, and they've been running for about 3 or 4 months. We've just had 2 new members of staff join the team as well, so hopefully we can start to really increase our capacity and step down a little bit, so we're not only working with families in crisis but also with families that we're concerned may be heading that way, and we know that if we can intervene earlier then our interventions will be more effective essentially. And then the third part of what we're doing is we've set up a new panel, which is called the Valuing Families Partnership Panel. The reason why we've set this up is because we don't think that supporting children and families to stay together at home is just our responsibility, it's everybody's responsibility, and we work with a lot of partners. And we, through the kind of national programme, really wanted to impress that on our partners, that actually we're not the only people that can do things that can support children and families to stay together. Often we are working with a variety of like multi-agency groups, and they all have special expertise and support which they can offer to children and families, which can really make the difference. So the panel is going to be running every fortnight, and it's an opportunity for social workers to refer in families that they're concerned about, where we've got senior managers from all different agencies, both internally and externally. The social worker can come and present the family, they can talk about the challenges that they're facing, and then the services that that family will need to turn things around. I think quite often where we fall down is we may send out a team like Connecting Families to go and see a family that are in crisis. They will say, we need this, this and this to be able to stay together. The worker says, yes, that's fine. They go away, and a week later they come back and they haven't got it to offer because they're still waiting on waiting lists for referrals to go through, all the rest of it. So the aim of this panel is to really get around that and get those services in for families at the right time. So we had the first one today. It was very well attended. We had a number of services allocated to families that were really on the edge of entering care. And hopefully we can kind of continue to grow from that point. So that's the aims of Valuing Families.
Good evening. To introduce myself, my name is Sarah Bridgman, and I'm the design lead for fostering in the Families First project. So the aim of the fostering project is to increase the number of children in care living with our Bristol City Council foster carers, or what we call in-house foster carers. That's no mean feat when, I'm sure as you're aware, there's a national issue with sufficiency of foster carers. But that's what our aim is. So we've approached this with a 2-stage approach. So our first priority is really been to get really good, clear understanding of who our Bristol foster carers are, what help they can offer for our children in care, and to make sure that we're using all of our resources, all of our beds as we best possibly can. So to do that, we've developed a series of new, or we are developing a series of new tools, and we're looking at that to help refine our processes in the service. So as Heather mentioned, the first one that's already being created and is embedded in the service is what we're calling a carer and vacancy register, which is essentially an enormous list of all of our foster carers, every single bed that could be offered for a child, how they're being used, if a child is sleeping in that bed, who that child is, if they're not, why they're not, if that bed could be used as a potential in future. Sounds really simple. It's been incredibly complicated. It's real time. It's being updated on a minute-by-minute basis by the team. But it's what it's given us is an incredibly clear and transparent view of our sufficiency in Bristol and how best we can use that. So that is a tool that's already embedded in the service. The second, almost sister tool to that, is a search and matching tracker. So that's all starting at the opposite, starting from a child's point of view. So all the children we're being asked to search for beds for, it's really clearly understanding who they are, what their needs are, so then we can put the two bits of information together. What we know we need to do to create safe and stable homes is to create the best matches possible. So that's our second tool, and our third one is a tool to understand the journey of any foster care, anyone who comes forward wanting to be a foster carer. So what happens from the moment they pick up the phone and they say they're interested in fostering to the time when they're approved at fostering panel. So it's really understand that process to make sure it's as efficient as possible. And then the second part of our project is to look at growing our fostering community through innovations. So the first one is something you may have heard of before. It's called the Capital Grant Scheme. So we're working up a business case to create a scheme whereby foster carers can bid for grants so they can either extend or adapt their homes so they're able to offer more homes or safer homes for more children in Bristol. And then the second business case we're working on is a support carer service. So currently when people ring up to say they're interested in fostering, if they don't have the right things that they need to be able to be a foster carer, which is sometimes a spare room or be over 21, if they don't have all of those, we don't want to put the phone down to them, which is what we currently do. We want to say, if you can't support our children in care by being a foster carer, what else could you do? So to create an in-house service where we grow our fostering community by expanding that to other people who can also offer support, but they aren't necessarily able to be foster carers. The other priorities that we've been working on throughout the project is participation with our carers. So it's really important that our carers are part of the voices and are coming on this journey with us. So we've regular comms with them to tell them what Families First is, what we're doing, to ask what their opinion is. We also launched a survey which was sent out to all of our foster carers in June to ask them about all aspects of fostering. And then hot off the press, this week we had a participation event with over 40 of our foster carers to really talk to them, tell them what we're doing and get their input and their say and their voice into how do we develop this project going forwards. We've also completely revamped and rewritten our fostering website. I don't know if you've ever seen it. It was written about 7 years ago, and the service has changed quite a lot since then. And what we've tried to do is to make it really Bristol focused, to talk about why you should foster for Bristol. We've used the voice of carers from the survey to say what they like about fostering for Bristol, because we know that websites are really important for people. It's our shop window for people who are considering fostering. So why I'm proud to be part of the Families First programme is because what I see is that we're delivering really transformational, much needed and tangible change. So we're working with our strategic partner who are confirming what we think we need to do is right by looking at our data. I know my service, I know what are the strengths about it, I know what the difficulties are about it, and I know how to work with them. So it's about taking the evidence-based and making it work in a service so it makes their jobs easier. And then with participation at heart, so it's about delivering solutions together. And as I've just described, the Care and Vacancy Register is a really, really good example of that that's going to benefit everyone. So we're already seeing the difference. We've talked about numbers. At the start of the project, we had 318 children living with our in-house foster carers. We're currently at 337. So the numbers are going in the right direction. That's giving us all hope that we're doing the right things. So the service can see the benefits, and ultimately we're really confident that children and families will too.
Hi everyone, I'm Richard Pears and I lead on two projects, the Coming Home project and the Cost of Care and Commissioning project. I won't go into too much length because Councillor Townsend has kindly introduced the Coming Home project, but just to let you know that we're at 33 children that we've managed to successfully transition from children's homes back into family-based homes. Just to give you an insight really in terms of what's really worked in kind of achieving that really has been our collaborative relationships with Vic's team, with education, with our health colleagues and with our social care colleagues, because that's enabled us to find the right home with the right school, with the right health services around for the child, so that they can, you know, transition out of their children's homes into a family-based home. That's kind of what we want. So that collaborative partnership has been essential, and we meet every week, and we've got really good commitment and aligned kind of approaches to supporting children and making sure that they can move into family-based homes as quickly as they can. The other thing with that project is that obviously it's been successful, and we've now in a process where we can embed that as a kind of business as usual function within our process. So we've gone through all of the modelling, and that's going to be a pathway that we can be consistently delivering on, and making sure that that's sustainable for the, you know, right now, ongoing and into the future. The other aspect of my project is what's called the cost of care and commissioning, and what I'm doing at the moment is reviewing all of our high cost out of area children's homes placements, really trying to build relationships. And when I talk about building relationships, it's about having real conversations with real people about our children, making sure that they get the right care, the right support, but also making sure that we're getting value for money. And when we're not getting value for money, then I'm negotiating and reducing costs. So we're seeing real financial efficiencies from that piece of work as well.
Hi, I'm Maria Finlayson. I've been working as a social worker in Bristol for 25 years, and before that I was a foster carer. So my substantive post is as a service manager for our children in care. So I feel quite privileged to be given the opportunity to work on the Families First programme, use my knowledge and experience to support the transformation. We know that children do far better and their outcomes are greatly improved when they grow up safely within their families. And I'm the design lead for permanence, and my focus is on reunification and special guardianship currently. We're looking at 100 children in care who have the potential now for either reunification or special guardianship. For when children do need our care, we'll continue to work closely with their families and networks to support future reunification and kinship. So we'll work closely with our independent reviewing officers through our children in care reviews to ensure that we're constantly reviewing and assessing. And we do this by also reviewing and assessing the family time our parents have with their children. So when children initially come into care, that could be supervised. We can move to unsupervised. They can move to having family time at home, to having staying family time at home. All of those things will greatly improve their relationships with their family. And it's not only their immediate family, but their extended family. And Adam referenced the family group decision making. We'll be using that and upskilling the workforce to enable them to carry out those family group conference decision making meetings. We're going to come up with a snappier name because it's a bit much, with their children and their families. And where it's not possible for us to ensure our children can go home, we'll make sure they maintain those lifelong relationships. We've been updating the policies, writing policies, developing guidance and training to upskill the workforce to make sure they've got the right skills to carry out their job. One of the policies we've introduced is the long-term fostering to SGO. So for kinship carers, for our mainstream carers, our in-house mainstream carers, and even our independent foster carers, they can move to having the child on a special guardianship order. And we have an offer for that now. So, and what we're really committed to is looking after children who require our care only for as long as they need to be looked after, and working tirelessly and throughout their care journey and asking ourselves, what do we need for them to return home? And this will ensure we can then focus on the children who do require our care. As you can see, the numbers are very high. Thank you.
So just to say thank you very much. We often have someone coming to present to us about, forgive me, the sort of real work, because so you're not just hearing from me. And it's lovely to, I think, to hear, particularly under a transformation paper, this is what the transformation work does. And often we talk about money, and rightly, but really what you can hear, I hope, is that we are trying to make a significant difference for children. It's also lovely to have social workers talking about the work that they do in Bristol. So I just want to say thank you to the team, and thank you for allowing us to present the work that we're doing here. I don't know if there are any comments or questions.
Did anybody? Councillor Varney, yep, put your hands up.
Thank you very much for the presentation. Very informative. I really enjoyed listening to you all. Just to highlight that there is a fantastic new film that's come out by Bristol City Council this week called The Run, and it's raising awareness for fostering. And I advise everyone, it's quite moving actually, so you will have a tear in your eye when you watch it, but hopefully that will inspire more people to look into foster care. I just had a question about the cumulative programme benefits. Obviously we're trying to get an annualised financial benefit of £11 million. Looking at the graph on page 48, the top of page 48, we're ahead of the curve, so it looks like we're going to reach our target more quickly than we thought we were going to. I don't know if anyone can tell me why we are ahead of what we're doing. It's such good news, and also, is there a chance that we might actually achieve more than the £11 million cumulative benefit, or are we just going to achieve that £11 million more quickly?
So we are part of our delivery is very much focused on our KPI. So financial benefit is linked to that, and so the way in which we're able to track and monitor how that KPI is doing is sort of the indicator as to how much of the saving that we'll be able to make. I think at the moment a large part of that is in relation to the Coming Home project, because that was a project that started earlier, and so the financial sort of realisation of that project has been also seen earlier, so we've been able to that's probably a large majority of that early sort of cumulative benefit. And yeah, I mean, we're really hopeful. We have got to see what happens with the other projects. There will be a coming together, hopefully, of like all of the projects at some point, but we are at different levels at different times. So we are focused on sort of trying to understand what's happening with that KPI, understand the drivers around sort of the money side of it, and then that's our opportunity to try and make sure it's going in the right direction. But yeah, we are hopeful.
I mean, part of the focus around the programme is particularly data-driven, so it's child by child, cost by cost, building up, so that's what you can see here. I've got my finance business partner sitting over there, so I just need to say to you that yes, we're hopeful of making the total savings, but I have also got a stretch target on top of that. So if we make more, we will be pushing into that stretch target, which is already banked in terms of a saving. I'm really hopeful that we'll make that too, but it is obviously really dependent on the progress that we make.
Ellie? Was it you? Yeah. No? Oh, sorry. I had Susan and then Shona, because I saw you've, yeah.
Sorry, I wasn't quite expecting that. I just wanted to really say that it's great to hear about all this, and like you say, having that kind of tangible, gone from a relatively dry kind of paper about transformation programme to seeing actually what it means on the ground, which is great. I wanted to very quickly ask a bit more about special guardianship orders. I have a sort of very vague understanding of them, but it'd just be really interesting to if you could explain them a little bit more on the sort of pros and cons for children and families.
Right. On in general, how they are. Okay, so special guard, it's a private law order, although we will issue to make those orders when we're discharging a care order, to make the special guardianship order. So it gives the special guardian the parental responsibility and overriding authority to make decisions. If people know about the old residence order, the child arrangement order, it's more of an equal footing, whereas with the special guardianship order, you have the primary responsibility. if you have a special guardianship order and at some point it's discharged, you're still considered as somebody significant who had PR. So later on, if something happened, so it's quite it's an order that gives the carer a lot of power to make all the decisions about the child. There are some certain decisions, like taking the child out of the country, is where it gets slightly complicated for a long period of time, not on holiday, for a long period of time. We have different offers for special guardianship orders being made at different points. This the one I referenced, which is our long-term fostering to special guardianship offer. So it's quite a generous offer in order to find permanence for those children. Because again, we know that outcomes for children growing up safely outside of care are better than if they remain in care. I don't know if that's told you. I could,
It's something that I've come across through a resident, but haven't really properly understood. Or just seeing it in this context is really helpful. So thank you for explaining it a bit more.
I wonder if Sarah wants to promote.
I was going to say, please, could you signpost anyone who comes to you to ask about anything special guardianship orders? We launched a Kinship Bristol website a couple of months ago, which has got, it's our offer, so it's got all the information that anyone should need in terms of any permanency orders, in terms of child arrangements order, private fostering, special guardianship orders, kinship foster care. It should hold all of the information on there, and also signpost people to other organisations. So if you Google Kinship Bristol, it should come up, and it's very closely related to our Bristol fostering website too.
Okay, and Susan?
I kind of got two questions really. With regards to bringing our delightful children back into our area, we've got 33 children that have been brought back in. Yeah. My question about that is, what is the criteria that you use to have out of all those children out there for those 33 in terms of how it benefits the young person? Is there an age? Is there financial? Is there, connecting back with family? Is there a particular criteria that you're using to bring particular children back at any given time?
Yeah, I think all of the above, really, because I guess it was very much dependent on the child's care plan. What we've learned was that all of our plans for our children are bespoke to their own needs and their own situation. But what we did is that we reviewed every child that was in an external children's home, and then reviewing their care plan and kind of where they're currently living and kind of our aspirations for them. We then started to identify those children that we felt we could then start to move into fostering. And we're still doing that. So we meet every Tuesday, and we're still reviewing those children on a regular basis because their care plans will change. So it's part of an ongoing sustainable program. But just to reassure you, there was nothing specific that we looked at one child over the other. It was based on kind of their needs and their care plan and what's most appropriate for them. So, and that's kind of what we've learned, is that when we're transitioning children, we're kind of learning every day about how to do that, because it's making sure that they've got their, the right school, and right services. To give you an example, one child that we transitioned, the school that he was living in out of area did a school assembly for him to say goodbye. And it was those little things that kind of helped that child move to a different area and makes that successful. So we're learning about all those little things that we want to add to that process to make it the best, the most smoothest and easiest move that we can.
That sounds perfect, thank you. The other thing was, we talk about kinship. So kinship is when children are placed within the external family, the wider family. So if the parents aren't able to take care of a child, it might go and live with a sister or a mother or something. With regards to the additional support and all the rest of it, and the whatever they would give to a foster carer, would that same kind of support be given to that kind of kinship order?
I think I'll answer part, and I think Sarah will answer the second part. When I'm talking about kinship, I'm talking about foster carers. So we have some foster carers. We actually have 147 of our children are living in kinship foster households. That's where a connected person has been assessed to foster the specific child. So they're not mainstream carers. They don't take, they're not on the emergency list to take other children. It is just for that child that they're connected to. But there are lots of other types of kinship. So I will pass to Sarah.
Yes, Maria is correct. So in our kind of cohort of foster carers, some of them are kinship foster carers, so they're registered, approved kinship foster carers. And it's really clear, the regulations are really clear that we have to give exactly the same support and considerations to both our in-house or mainstream foster carers, as we call them, on our kinship foster carers. There are some nuances and there are some differences, and we've learnt that because, for example, in our support groups, our kinship foster carers have a slightly different relationship and reason why they're there compared to our people who've elected to come forwards and be carers for children who aren't connected to them. So there are some differences in how we support them, but essentially, yes, we have to give them the same degrees, so they all have supervising social workers and they have access to the same support. In terms of support for our other kinship carers, and again, if you look at the website, it really clearly talks about how they might be in this other side of the service. So we have a whole kinship team who work with assessing kinship carers for SGOs, and we have a dedicated special guardianship support team. So anyone who has a special guardianship order under Bristol can have access to that team, but it's on a voluntary basis. So they can get in contact with them. They can ask with all kinds of support. They can ask for signposting information. The offer is wide, and in Bristol it's a very extensive and it's a very generous offer actually.
So I just want to say thank you for the presentation and for the follow-up answers. They were really good.
Shona?
Yeah, thank you. This is really, really exciting because this is my background. I've been a social worker in child protection and kinship care and foster care. So this is really good news that we're looking at here, especially considering we only did the investment in May. It's very impressive, so well done. And yeah, I think this is just a really clear example of invest to save, and where this is obviously clearly making a big difference. And I loved the references to relationship-based practice throughout, because we know that difficulties in relationships often cause a lot of these breakdowns, so we need positive relationships to help to repair them. And the case study on page 47 was really helpful as well, thank you. I had a couple of questions. One was about the panel. You were talking about the Connecting Families panel, Valuing Families panel. I just wonder if you could tell us a bit more about the professionals that sit on that. I mean, does that include things like CAMS and adult mental health and housing? I appreciate you only had the first one today.
So it's a developing picture is what I would say. So we have a very wide range of representatives, but we want more. So we have people like housing, we have CAMS, so we have a kind of link worker that sits across children's social care and CAMS called a primary mental health specialist. So the manager of that team will attend the panel. They can offer some bridging work while they try and get children into kind of mainstream CAMS, because often that process can take a while. Yeah, we have drug and alcohol services, we have youth and community services, specialist teams like Bristol Autism Team, that kind of thing. So lots of different services, some of which, in order to kind of make sure we don't feel like we're wasting a lot of their time sitting in a panel where they're not always going to be needed, they're on invite-only basis, so it's quite a long list. There are some that we're still kind of focusing on to try and get there at the moment. So adult mental health is a particularly difficult kind of nut to crack in terms of getting them to attend and getting the right people there. So we're continuing to work on that, and I think there's a little bit of work to do around kind of getting the right people from the police, so our colleagues over in the police, to attend. We'd hoped that would work today, but it didn't quite, so we need to go back and look at it. But generally, I would say the kind of the picture from a lot of our partners, and I think again this is really helped by like the national guidance being partnership guidance around the Families First programme, not just for social care, is that I am saying that to people and they are responding quite well. And I think part of that is to do with the work that we're doing alongside Newton, so the people that are supporting us to make the changes in terms of the data that they're able to produce. So what I've been able to offer to services is to say, you need to come to this panel because you have a responsibility to do this, and that is set out in the National Families First programme. And if you come to the panel, I will build a dashboard which will track the actions that you're taking, the outcomes of those actions, and whether they lead to children remaining at home or not. And then I will give you that data so that if the DFE or anybody else asks you for that information, you can then present it to them and say, look, we are supporting children in Bristol to remain at home with their families safely because we've done this, this and this. So it's kind of trying to give a bit of a trade-off to get them to come.
Thank you, that's helpful. And my second question was about the family group conference work, because we know that can be really valuable in getting extended families around the table to get them to chip in, because often extended families maybe don't realise how dire the situation at home is until everyone comes together. So I just wanted to check, is that something that sort of the allocated social worker is expected to do, or are there separate professionals that take that work on?
So the wider picture around family group conferencing, there's two different approaches essentially. There's family group conferencing and there's family network meetings. So a long time ago in Bristol, we used family group conferencing. We had like an externally commissioned service that would come in to do it. Bernardo's did it. For various reasons, that didn't really work. We're talking over 10 years ago that we accessed that. More recently, we've been using the family network meeting model, which was aligned with signs of safety, which is our kind of wider practice model. So that is not in the same way kind of a licensed approach. And I think we've struggled, I would say, to fully embed that into all of our practice. So within the National Families First programme, there's the family group decision making, which is the umbrella for all of it. And we know that we must do that in pre-proceedings, but we also need to do it we need to aspire to do that at every decision-making point that we can. So we really make families central to the plans that we're putting in place. So we're kind of developing what that will look like through our service. It is very complicated. It involves changing all of our kind of processes, embedding it within those processes, and at different stages, it's likely we'll have a bit of a kind of mixed economy of family group conferences and family network meetings, depending on which stage you're at, but we're not quite there yet to say which areas. So if you're receiving a family network meeting, that's likely to be delivered by the lead professional, so like your allocated social worker, say. Although to call it family group decision making, we have to offer to the family for someone else to do it if they would like. If you're receiving a family group conference, it's very likely that will be by someone independent of your social worker.
Thank you. That was very in-depth. Overall, we're sort of we're still waiting for some of the guidance to come out for nationally in terms of that national reform. So I think at the moment we've just got lots of skilled social workers that are leading on that practice, and part of our role in this is really to try and think, how are we going to develop it in all of the ways that Adam's just talked about, to make sure that we're fully compliant, and also we're making the right decisions for families in line with that national transformation as well.
Thank you. Yeah, I'm sure you have very experienced people working on it. In my own personal experience, it has worked a lot better when there are dedicated workers who have that time to dedicate to it, rather than an allocated social worker who probably has a million other tasks to do. So I will feed that back to you, but I appreciate that you are doing a lot of thinking around this as well.
Katja, did you want to? No? Okay. Oh, okay, thanks. Okay. Any other comments or questions from committee? Thank you so much for coming in and sharing what's been going on within the transformation. And I think it might be a good time for me to now. A lot of what's going on we look at in Corporate Parenting Board, which I will talk about every time we come here, about the importance of the Corporate Parenting Board. And the run will be shown at our full council like we did last year, because we are all part of the corporate parenting. So we will be watching that, the video here. And as we lead into next year's budget, the ask is around what I am putting forward is to make sure that the support that we are offering our foster carers, our kinship carers, and our special guardianship builders is as good as it can possibly be. And it's wider than children and young people. This is about looking into the other elements of our council and out into the One City boards and seeing what else are they doing, what more can they do, so that group of families and those groups of children are absolutely at the forefront of everybody's thinking when they're either designing their services or they're thinking about how they might do, they've got various things going on, and that can be in culture, it can be in transport, it can be in all sort, whatever element of life that is. And so just to share that really, and I'm sure that my fellow committee members will go back to their own parties and push for the whole council to really come together to start supporting those really crucial adults and families so that we can keep our children in Bristol and we can give them the best start that we possibly can. Thank you very much for coming in and sharing with us. Thanks. So item 8 is for us to note. So we're going to move on to item 9, and this is the Education Capital Programme update. And this is for Vic. You're going to present this to us. Yep. Okay. Thanks very much. Over to yourself.
Thank you. Thank you. So we're bringing this report to our committee to approve 2 major SEND capital projects, which include the development at Henbury Court and St Anne's schools, delivering a combined 54 new specialist places for children with SEND. I'm joined by Oliver Roberts, who is our newly promoted programme manager in our team, and has been also, you may know, has been leading the work on developing the Trim Valley Free School project as well, and is now our programme manager. So the projects that are described in the report link to the wider corporate strategy of the council, which prioritises education and also talks about our priorities in SEND that link to our SEND strategy. They also link to the SEND sufficiency strategy, which will be coming to committee next month, which talks about our need to develop 569 new specialist places across the city, particularly for children with autism, speech and language communication needs and SCMH needs. And the programme is a key lever for improving outcomes for our children and also managing our high needs block deficit. So the 2 main proposals in the report, so Henbury Court Academy refurbishment, which is to refurbish an underutilised building and create 30 new places for children with autism spectrum conditions. The project cost is approximately £1.398 million, which includes the feasibility and incurred expenditure. And delivery is expected by early summer 2026, in which case would start supporting children from the new academic year next year. We also have St Anne's Infants Works. This is a project that initiated some time ago, but additional funding was sought because there were a number of new issues following unexpected damage identified in the roof, which required further surveys and then a feasibility to understand what level of work was required there. The building is also listed, which brings its own complications in terms of planning, so that the committee will be aware of some of the challenges around that. The project, when complete, will create 24 new specialist places for children with autism. Total projected budget is £3.429 million, so the committee is asked to approve an allocation of £2 million towards that project, and delivery is expected in early 2027. We also note some additional updates in the report. So Throgmorton School, which has been completed, is available for use and will eventually offer 50 places. We are working with special school providers in the city to look at a provider for that setting, which we expect to open in April of next year. We also have noted in the report 2 project closures. So one, which is King's Weston. We'd like to do a different project with that school, and therefore what we have done is closed a scheme that was part of an original programme there. We note that the school has already taken on some additional role in that setting, and we're going to work with the school at King's Weston on a slightly different scheme and reallocate that funding that was allocated to this project to a new scheme. The second is Moorlands Road, which we note is not viable for SEND provision for a number of reasons, particularly financial viability. The costs of the scheme since being brought to committee some years ago have nearly doubled. There are also some operational concerns in that it would be a school for only 18 children and therefore wouldn't have the breadth of provision for children being so small, but also unlikely to be able to attract high quality staff and may potentially struggle in terms of funding at such a small scale. We also note that it's a setting that's in the community and therefore most of the schemes we have been prioritising in our programme are those where they are on a school site already and within the safeguarding halo, if we use that term, of a school, so resource provision which might be within the grounds of a school, whereas this isn't, and therefore it was determined that the project should stop, and we've been engaging with the providers, particularly a community organisation that work from the same building, but also the Academy Trust that was seeking to run that provision as well to inform them of that decision. So I think in summary, this is the first of what we hope will be a number of projects coming through to committee in the next few months and into next year to sign off additional projects. But in particular, this is a report summarising allocation of spend towards developing 54 new places across the city.
Okay, Andrew's got his hand up straight away. Off you go.
Yeah, unsurprisingly, I suppose, as St Anne's Infants is in my ward. But yes, I'm really pleased to see this report come before us this evening, and I hope members will support it. I know that St Anne's Infant School have really struggled for over the last year, really. They lost about half their playground with scaffolding and hoardings, and they also lost quite a lot of their space. And the staff at the school even gave up their staff room to facilitate more space for children's education. Obviously, staff need a staff room, and that is not ideal. So a question I wanted to ask really is there a possibility of temporary provision while this work is carried out? Because we're talking at least another year or so before the new scheme is finished. And I don't think it's fair on the staff to go without a staff room for that length of time. So I'm just wondering if there's a possibility of some sort of, I don't know, a shipping container or porter cabin, or, getting in touch with St Anne's Church across the road, and they have a community space there that could be used by the school in some way. I just think we need to look after the staff going forward. And also just wanted to point out that yes, there's a problem with the roof in the scheme that we're hopefully going to support today, but also the wider school campus is in quite a poor state. So at the start of the year, I was told that bits of masonry was falling off the building. So it does need to be looked at overall. It's a listed building. It deserves to be given the care and attention. So, but yes, on the point about temporary provision, I don't know if you could respond to that, please, Vic.
Yes, of course. I met with the head teacher of St Anne's, and we had exactly that discussion. I think the staff at the school, have been tremendous in making space available for children, and particularly learning, and not, at the sacrifice of their own space for their breaks, and rightly so. And I think it's not something we've looked at in terms of temporary. There isn't a huge amount of space on the site itself, so we want to. I was just talking to Ollie there, and we will have a look at what temporary space is available. And if there is a community building that can be used, then again, we can explore that. So we'll take that away from the committee. I think more broadly, the roof challenges that we've experienced in this resource provision are likely to be quite similar in the main building as well, as we know. We have a survey being undertaken, which once returned as part of our kind of broader corporate landlord responsibilities, which sits with our property team, will give us an indication of what the level of investment needed is for the whole building to be brought back up to standard. So I don't have the figures on that just yet. We haven't been given the feedback on that survey, but when I met with the head teacher, we talked about the condition of the main building as well as the use of this building as well.
I think that's a fair ask. Thank you. Any other comments, Katja?
Due to the nature of the fact that the site is still going to be run by Brimhill Infants, I'm not going to vote on this one. However, I just want, the only query I had, I do understand why the Harry Crook Centre is not being used, and I can understand that, and I'm definitely in agreement with that. And I also realise that obviously each centre is for different needs and for different ages, being school and that. But it just seems that a lot of the schools are either up north or down south, and there's nothing in Brislington East. Or is that just my perception? Because we do transport the children, we don't want to transport them right across town every day, if we can avoid it.
There's two parts there. I think one, perhaps that, so when that comes to the next committee, we'll have the sufficiency strategy, which will show all of the data. So I might kind of, sorry, not to defer it a whole month, but there will be a much richer presentation in terms of that consultation. Our highest area of need in the city is in the south, and it's also where we have insufficient provision. So I think that's not to say that is the sole place where we will be developing capacity, but it is the area that comes up the most in our strategy in terms of where we feel we need provision. So I don't know if that answers the question, but these are two of the schemes coming through, and we're bringing, I suppose what I should say is we're bringing schemes at the point at which they're ready to be approved, not as kind of one bigger package. So there will be more schemes in the coming months, and next month's committee will talk much more about how we see that rolling out across the whole programme.
Okay, brilliant. Thank you.
Anybody else? Any questions about this? Okay, so one of the things I did want to mention at this point, because we're talking about SEN places, is we still are yet to hear from the Department of Education about the free school, special school in Southmead. That was approved in 2022 as part of Wave 3. And since the new administration, the new government came in, it's on pause. They can't confirm with us whether it's still going ahead. We've asked that the capital is given to Bristol so that we can start to get on with it. We are still waiting for central government and the DFE to give that go ahead. I'm getting increasingly concerned that it may not materialise, that special school comes to fruition. Another point I want to make is there's 168 places within that school, and it is part of the safety valve contract that the previous local administration signed with the Department of Education. So the apparent savings moving forward in that contract include the fact that that school exists. And we think that we're trying to get through capital programme and school places now. The numbers of children that are waiting for specialist places are raised time after time by us as a committee. We need that special free school, but I need to be really clear that we are becoming increasingly concerned that it may not materialise, and we are going to be back to square one when it comes to specialist provision if that's the case. There was a time when we weren't publicly speaking out about the fact that this was the concerns that we had around that Wave 3 special free school that was agreed in 2022. But I think that we are getting to the point where it's becoming necessary for that to be vocalised in public so that we are all really clear about the concerns that we have about meeting the needs of the known and measured needs that we have of children with additional needs in this city. And I just want to be really clear that that's the position that we're in. We think that it will come out basically after the autumn budget. Is that what it's called? We think that that's when the DFE so the Chancellor will give her autumn budget, and then we think the week after that, that's pretty much when the DFE will be telling us and other local authorities that are waiting on these specialist capital projects to get the go-ahead. So we will see where we are. Hopefully they will they will agree that yes, it's going to go ahead, and then we want to bring it into Bristol so that we can do that capital project. We know the Temple Quarter Oasis Secondary School Still not on site. It was supposed to open in 2017. That's a DFE project. We know that it's beginning to move now, but it's far too late. And that's not to say that in Bristol it won't come in a little bit late. We generally run over as well, because that's kind of part of what construction and planning and building on a new site is. However, it will be priority number one in Bristol in the way that it won't be at the national DFE level. So that's why we're going to continue to ask for it to be bought, and we can deliver it and sort of take that off the DFE's hands, really. Okay, so we have got to vote on this. So I need to read out the statements for the kind of formality of it. So we, as the Children and Young People's Committee, are asking that we, 1, approve the delivery of the capital project to provide 13 new school places at Henbury Court Academy as part of Bristol's SEND provision. Number 2, authorise the Director of Education in consultation with the Chair of the Children and Young People's Committee to take the steps required to spend the 1.178 million of project funds for the Henbury Court refurbishment project, including procuring and awarding the contracts over the key decision threshold as outlined in the report. Thirdly, approve the expansion of the existing St Anne's project to include the roof and other associated works, and allocation of a further 2 million, taking the total budget for that to 3.429 million to allow the project to be completed. In brackets 1.6 from the school's condition grant and 400k from the high needs unallocated contingency fund. And lastly, authorise the Director of Education in consultation with the Chair of the CYP Committee and Director of Property Assets and Infrastructure to take all steps required to spend the funding on the St Anne's project, including procuring and awarding the contracts over the key threshold as outlined in the report. Can I have a second, please? Thank you, Councillor Funny. Oh, yes, Kat, you're not going to vote, are you? Okay, so all those in favour of those 4 elements, please raise your hands. That's unanimous. Thank you very much. And we move on to agenda item number 10. The SEND Information Advice and Support Service contract. Gail's on here, but so Heather's going to present this for us as Gail is unavailable today. Over to yourself.
That's right. So this report seeks approval for a new contract to deliver the statutory special educational needs and disabilities information advice and support service. This is a statutory service. We're proposing a new contract for 3 years from the 1st of April 26, with an option to extend for a further 2 years until 31st of April 31. It will be a jointly commissioned service with North Somerset, South Gloss and the ICB, providing some economies of scale, but Bristol will take the commissioning lead on this one. As I've said, there's a duty under the Children and Families Act to provide this service, and the requirements for exactly how it's provided are set out in the SEND Code of Practice. So everything that we're proposing will be commissioned in line with those things, and also the 2019 National Minimum Standards for SEND Information Advice and Support Services. We've got quite a lot of good feedback from parents and carers and children and young people on the current contract, which works pretty well. It's highly valued by parents and carers and exceeds its targets. It's been really proactive in targeting engagement with underrepresented groups and undertakes quite a lot of outreach work into diverse communities as well. The contract will be year-round, open during normal office hours with a direct helpline and a 24-hour answer machine and callback service with signposting on that service as well, a website and social media presence, and accessible, accurate and impartial information available. Bristol's seen an 84% increase in the number of referrals to the service and 191% increase in the number of total contacts to the service since 2019, according to our helpline data. And we fund 30% of this contract, with the ICB funding a further 25%. So our total annual contribution to date in the current contract has been £156,320. So the funding commitment for 5 years will be £581,334.81, with the combined contract costs at just under £2 million. The provider has restructured under the current contract and sought efficiencies, but has faced a budget deficit in the last financial year, and we're estimating a similar deficit of 14,000 in the current financial year, which the provider is funding through charitable reserves at the moment. So we're proposing that the annual budget is increased by 11.5% to enable the current provider to properly cover their staff costs in the current contract. The future year's commitment is 1.88% to provide sustainability as well. So this report seeks the delegated authority to vary that contract to address circumstances where increased demand or rising costs may mean that the service can no longer meet the national minimum standards during its course of the contract.
Thank you very much. And Shona, and then anyone else, and Kerry. Okay, Shona and Kerry, and then anyone else. Raise your hand.
Thank you. Yeah, it's clear from the quotes that it's something that parents and carers really value. I was curious about why we've had such a dramatic increase in the number of referrals and contacts to the service since 2019.
I don't think we know precisely. We think it's something to do with the outreach work that we're doing. I mean, it's a bit one of those where you kind of want to see more people accessing the service. We do also know that we've had increasing numbers of education, health and care plans and children with SEND coming through our provisions. So it's probably a bit of both, a bit of increased demand, kind of real demand, and a bit of increased outreach work, so people accessing the service more easily and readily is what we think.
Kerry?
So for some of us OG parent carers, we know exactly what this service does and what it's for, and we remember its old name, supportive parents, and the consultation and why that consultation happened, because there was a lot of confusion back then about what this service was for. So I think my question is, if you're a new parent carer coming into this, how would you explain this service to them? Because when I first came into the SEND realm, like lots of other parent carers, we thought it was parent-led for parents, and then there was a lot of confusion about whether schools were using it, and what is this service for, and what are the differences between the parent carer forums, because both offer things like coffee mornings, and sometimes they do it in conjunction with each other. So could you explain for new parent carers what this is?
Yeah, sure. I think it's one of the things that we want the service itself doing, that they are doing increasingly well under the current contract, and hopefully under the new one as well, is to really be out there and explain what they can offer directly to parents and carers. And I suppose the other thing to speak to is the development of our local offer, which Vic might want to come in on as well.
Yes, so we're looking to improve the local offer, but we're also working with the Parent Care Forum because we know that the local offer itself isn't necessarily the way that all parents and carers want to access information. So working with Bristol Parent Care Forum, we thought about different ways that we can communicate it. I was going to add as well to Heather's presentation that the SENDS team are represented on all of our governance to deliver our SEND strategy. And what that means is that with the increased number of contacts that they've had, they're collecting that information, they're collecting what are the themes, what are the things that are coming through, and sharing that back with us. So I think in our executive meeting coming up in December, they'll be presenting some of that feedback as well. So it's not just about that direct contact, signposting, support to families, sometimes advocacy as well. It's also how they are thematically giving us that lens into what's happening in communities, alongside the other ways that we collect that as well to inform our work. And some of the funding that's wrapped up in this is also about their strategic work with us as a local area partnership with Health and the Parent Forum as well.
Ellie?
Just a very quick one, really, to say that I used this service a couple of years ago through a brief period, and it was absolutely invaluable. And as a parent, like Kerry, as a parent coming into the SEND realm and not really knowing where to go, they were, they held my hand quite a lot. So I'm really, I think it, as it is a statutory service, but I think it's really important to get to get this in place, and it's great to hear that, you know, there's lots of work being done to improve that service as well. I think it's just completely invaluable and supports a lot of the work that we've been talking about today around EHCPs and you know, and getting children through the system, because if as a parent you are informed and you have that support, it helps hugely. So I hope that the next contract continues in the same vein.
Katja, yeah.
I just want to iterate how important the service is, and that this is generally a very positive increase. I'm glad that you are giving a pay increases, and that you've mentioned the pay increases. You know my feeling on this, because sometimes we have the lowest paid workers helping the most vulnerable. I'm a bit worried about them saying that some people are on national minimum wage. But I will take it that they're giving them better pay increases, and I'm hoping that they're working towards that as well. Because, like I said, we have a problem with poverty, and we have a problem with the very people that support people that desperately need it. Often are the ones that are poor, which seems a bit unfair to me. But I just had to say it.
Anybody else? Okay, I have got one question about the percentage table. So it's under number 6, so it gives the kind of percentage breakdown out of 100 as to how much is contributed to the service from, so you've got the 3 local authority areas, and then it's got ICB in brackets Bristol. What's going on with ICB North Somerset, South Gloss? That would be my question. Or is that what they call themselves and it's for those 3 areas?
Yeah, the ICB contribution is for the full patch for the 3 areas.
Okay, so if there's no more comments or questions, there's another 4 things that I need to read out for formalities. Okay, so we are being asked as a committee to, 1, authorise the Executive Director of Children and Education in consultation with the Chair of the CYP Committee to procure and award the contracts necessary for the implementation of SEND information, advice and support service in line with the procurement routes and the maximum envelope budget that's available and outlined in the report. Number 2, we are authorising the Director of Education and Children to invoke any subsequent extensions or variations specifically defined in the contract being awarded up to the maximum budget envelope outlined in the report. Number 3, we are authorising the Executive Director for Children and Education in consultation with the Chair of the CYP Committee and the Director of Finance to vary the contract within delegated approvals where increased demand or rising costs means the service can no longer meet the national minimum standards. And lastly, authorising the Head of Procurement and Contract Management to approve appropriate procurement routes to market where these are not yet fully defined in this report, or if changes or procurement routes are subsequently required. So can I have a seconder for that?
I'll second it.
Thanks very much. And then can I have a raise of hands for those in 4, please? Everybody voting in favour? That's unanimous. Thank you very much. And that takes us on to agenda item number 11, which is the recommissioning of the Special Guardianship Order Therapy Contract, which is really well placed within our committee because we've heard about the Special Guardianship Orders. And Heather, this is for yourself again. Yep, thanks.
Okay, so this is another commissioning report seeking approval for the new commissioning pathway to deliver therapeutic support for children and young people who are cared for under special guardianship orders, which you've already heard a little bit about. So the new contract will be for an initial 3 years from the 1st of April 26, with the option to extend for a further 12 months up to the 31st of March 2030. We're seeking an increase in the value from £62,000 per year to £250,000 per year due to growth in demand. And you've heard a little bit already about where that demand is coming from. We are looking to have more special guardianship orders. So that is, some of that work is coming through. And also to bring some smaller providers onto the framework where they've previously been commissioned through spot purchasing arrangements. So again, the provision of therapeutic support for children subject to special guardianship arrangements is a duty for all children who were Bristol Children Bristol child in care before their SGO was made. The Adoption Special Guardianship Support Fund was confirmed by the government in September 25 to be in place until the 31st of March 27. If the fund ends at this point, we would face a cost pressure in this area. I think it's worth mentioning that. We have no indication that it will end, but we equally don't have confirmation beyond that point. However, the service is generally viewed as a cost avoidance, preventing children from returning into care and supporting those special guardianship orders to be really effective and supportive for children, keeping them safely within their families or within a permanent option. So as I said, it's a 3-year contract with a possible 12 months extension at a total cost of £1 million. There's no obligation to spend on this contract, and it could be ceased if the fund wasn't confirmed past 2027. So market engagement events for providers will take place between now and November if we're to go ahead, and that would support them to join the framework.
Thank you very much. Has anyone got any?
Chair, just to note that we did circulate a slightly updated version of this report, which is the version which is on the screen now.
To note it?
No, yesterday we circulated a slightly updated version, so just to note that that's the report you're considering.
Okay, yeah, thanks very much. Yeah, no, I'm just asking, are there any comments or questions from Shona?
Yeah, thank you. Yeah, I mean, as we've talked about, special guardianship often helps children stay within their extended families, and it's also far cheaper for the local authority than a child going into expensive foster care placements. My only question was about, in paragraph 1, it says, eligible for the service are all special guardianship children who were previously a child in care, who were immediately previously a child in care. I wondered why it doesn't include special guardianship children who weren't a child in care. I appreciate those numbers are probably quite small, but there may be some.
There may be some. So the DFE fund is specific around it being children who were previously in care. However, this contract won't be specific to that. So there's nothing to prevent us using these therapeutic services through the contract for children who, as you say, there won't be many of them, but who haven't previously been in care. But that's what's stipulated in the DFE fund.
Okay, thank you.
Katja?
I was just going to point out the special guardianship being different to foster caring, and that they don't always get the exact same support that the foster carers get, because it does cost the council an awful lot less. They do get a fund which is much less than the foster carer gets, and it's means tested, very heavily means tested. So this is welcome support, even if it's very little. It's a welcome support for special. I'm not going to say it the right way around, am I? For a special guardianship support. So it's just well to be noted that this is not the same as foster caring, because it's more like adopting. It's slightly different to adopting, but it's financially more like adopting. So yes, it saves councils awful lot of money.
Yeah, thank you. Anybody else? Okay, and that sort of speaks, Katja, to the kind of the ask that I've got of all these other policy chairs to make sure that when we're talking about foster carers, we're also talking about kinship carers, and we're also talking about special guardianship, because of the importance of what it is that they're providing for that child and for our city and for the future of. Yeah, actually, there's a good shout to also include those that may have adopted. Yeah, particularly children from care. Because of their life experience. Okay, so I've got another load that I need to read out the wording of, but we need to note that we did have an update, so it's the update that we are currently approving. So we are being asked to approve the recommissioning of the contract for therapeutic providers for the provision of therapeutic support to children cared for by a special guardian. The commissioning pathway applied will be the relevant conditions for their use are met, route to parent choice, route to market. We're authorising the Executive Director of Children Education in consultation with the Chair of the CYP Committee to take all steps required to procure and award the contract for 3 and then a further + years as outlined in the report. And thirdly, authorising the Executive Director of Children Education in consultation with the Chair of the CYP Committee to invoke any subsequent extensions and variations specifically defined in the contract being awarded up to the budget envelope outlined in the report. Can I have a seconder, please?
I'll second that.
Okay, thank you. Oh, yes. Okay, and so therefore we go to the vote because everybody voting for, please raise their hands. Unanimous. Thank you very much. And then we go on to our final agenda item, and it's 21 minutes past 7, so we're making really good timing here. And this is our corporate risk management report for Q2. And over to Hannah.
Yeah, and I think, I mean, a little bit of Groundhog Day, because we are looking at the same two risks that we looked at last time, although you'll notice that the one of them has been slightly amended to look at. So the two risks are, one of them is related to vulnerable children, safeguarding of vulnerable children, which is always a risk and should always be a risk on our register. And then the second is related to whether or not the statutory override for the dedicated schools grant will remain in place. And the difference between last report and this report is that now reflects the fact that the statutory override has been extended to March 2028, not March 2026, but we still will have an issue if it's not extended beyond that, or there's not a solution to the scale of the SEND deficits that are sitting with us at the moment. So there's two risks set out here. Christine has asked us to bring the risk list below this. So we do have a children and young people's risk list below this. These are the top level risks which we're reporting. What we will bring in our next risk report is those that sit below this, so that you can see, you know, what's coming up, what's bubbling below this, the assessment of impact against those risks. One of those, for example, we did used to have a risk on this top list about unregistered children in unregistered provisions. It has been moved down because we now, as of today, have one child in unregistered provisions, which, as you know, is significant progress. We want to have nil, but there is one child remaining who is in a home which is waiting for registration. And so that risk was moved down into our children and young people's risk register. I'll bring the whole thing next time for us to talk through. I think there are other, and can I just slight sort of weak link with the previous item? One of the risks on that further register is if things like the adoption support grant were to be ended after March 2027, which we've just been talking about, that is a really significant risk for particularly adopted families and children, young people, or if it's to be reduced significantly. I think one of the worries that we have is that grant is reduced quite significantly, which will hit those services really significantly. So we need to watch risks like that. The free school risk that Christine has already referred to would also be sitting on that list. So I'm bringing you two risks, and the direction of travel has remained the same since last time, and we'll bring more detail next time. Thank you.
Any questions or comments? Go ahead.
I'm still going to comment why the EHCC, the long-term thing of EHCCPs is not a risk.
I would imagine that that's the one below this.
Yes.
This is the council level. So this is
I
for
did ask Tom, and
the whole council.
Yeah, he said that he doesn't understand either why, so we're going to investigate as to why that's not a risk. That's not put as one of the risks.
Oh, what, the council level?
Yeah.
Okay, fine.
Because it does affect the council. It's a huge thing about Bristol City Council that our EHCCPs is taking such a long time. We have so many.
Any other comments? Okay, we're asked to note this report. Duly noted. Thank you very much. Our office is gone, but thank you to those that still remain. Thanks very much, everybody, for your contributions. And our next meeting is November. Yes. We'll see you then. Thank you very much. Thanks.